The most common symptom of arthritis is pain. You may have stiffness and you may have swelling in your knee joint. So if you have any of these symptoms, do consult an orthopedic surgeon. Then comes the question, I've got arthritis, do I need a total knee replacement? The answer is no. Not everybody with arthritis needs a total knee replacement. We always try non-surgical treatment before we try a surgical one. Probably the most important thing that a person needs to do is to lose weight, especially when you're obese. That will help most of your symptoms. Modify your activities. For example, if you can't climb stairs, try and avoid stairs. If you can't squat, avoid squatting. Always stay active. The more active you are, the less pain you experience through the day. And probably the least important thing is pain medication. You are allowed to take some pain medications when you are suffering from pain, but the painkillers are probably the least effective medications in arthritis. There are a few other non-surgical modalities like injections into the knee joint. There are certain injections that we can give. It could be a cortisone or it could be a viscosupplementation. There are various joint preservation techniques that are available. You may be a candidate for a keyhole surgery. We do certain osteotomies to preserve your joint. When all these measures fail, that's when we start considering a total knee replacement. A decision to do a total knee replacement is purely individual. It's based on how much symptoms and how much difficulty that you are experiencing. A rough guide to probably start considering a total knee replacement is when you start to struggle to get through the day, when you start having night pains, and when you have increasing need of painkillers than what you used to have before. So, the best thing is to talk to your orthopedic surgeon, have a detailed discussion with your surgeon, and then consider a total knee replacement.